Welcome to the Live Well Madera County 2023 Community Health Assessment, or CHA. In this video, we will provide an overview of the key findings from this assessment. The Community Health Assessment helps identify key needs and issues in Madera County. The information in the CHA is used to make plans to solve these challenges. The process of developing the CHA begins with gathering primary and secondary data.
Primary data is first-hand data gathered locally by connecting with various stakeholders, community members, healthcare providers, educators, and local organizations. The three-way in which we collected primary data was through surveys, focus groups, and key informant interviews. In total, we collected 1,699 surveys, held 11 focus groups, and conducted 21 key informant interviews. Other data, known as secondary data, was also reviewed. Secondary data comes from a variety of national, state, and local sources, like the U.S. Census and the California Health Interview Survey. Our community health assessment begins by looking at Madera County population, also known as our demographics. Madera County has a population of 156,255 residents. Hispanic Latinos make up 59.6% of the population, followed by 31% of the population who identify as white, non-Hispanic. The top three languages spoken in Madera County include English and Spanish, followed by Punjabi. The median age of resident is 35.1 years old, which is younger than the median age of the state overall.
Now let's dive into the key findings of the 2023 Live Well Madera County Community Health Assessment. This assessment is divided into three main sections: social determinants of health, health behaviors, and health outcomes. There are 8 issues that were identified as top concerns in the CHA. They are economic stability, neighborhood and built environment, access to care, social support, domestic and youth violence, substance abuse, chronic disease, and mental health.
Social determinants of health are the conditions in which people live, learn, work, and play that can affect our health. Social determinants of health are important because they have a large influence on the things people do for their health and their overall well-being. The social determinants of health are made up of 5 key areas: education access and quality, economic stability, neighborhood and built environments, access to care, social and community context. The issues that rose to the top of the social determinants of health area were economic stability, access to care, neighborhood environment, social support, and domestic and youth violence.
Key findings show that Madera County has higher unemployment and poverty rates than California. Transportation and access to inexpensive and healthy food was a common concern among focus group participants. Survey takers said safe places to be physically active and access to healthy food are the top 2 greatest needs of children and families. There is fewer primary care, dental, and mental health providers available to Madera County. A need for more social support was brought up in all focus groups. Discrimination, social acceptance, and social isolation were specifically mentioned in LGBTQ+ and African American Black focus groups. Pregnant women and new moms mentioned the need for more support at work and more leave time, as well as long-term social support. In 2020, reports of child abuse and neglect were higher in Madera County than California. In 2019, the juvenile arrest rate in Madera County is higher than the rate of California. Madera County resident survey takers said a higher living wage, affordable housing, and jobs would most improve their life. We work on things like education, jobs, and housing because it affects a person's health. Our goal is to make sure everyone has a fair chance to be as healthy as possible.
Health behaviors are the things you do that can affect your health. They can be influenced by your family, community, and the people around you. These behaviors can be changed. Substance abuse is a health behavior and was one of the priority issues identified in the CHA. Key findings in Madera County for substance abuse. Drug abuse and alcohol abuse ranked in the top 3 of behaviors that affect the health in the community. The percent of alcohol-impaired driving deaths in Madera County is higher than both California and the United States. 43% in Madera County compared to 27% in California. Alcohol and drug abuse are considered risky behaviors and can make you more likely to develop a chronic or infectious disease. On the other hand, doing positive things like eating a balanced diet, daily exercise, and getting the recommended amount of sleep are considered protective behaviors.
Health status of an individual refers to how healthy they are overall. A health outcome refers to their health challenges due to the things like chronic disease, infectious disease, or other reasons. Chronic disease and mental health were the two health outcomes that were of high importance. It is important to know that chronic disease can take months to years to develop and have long-lasting effects. Key findings for chronic disease are: chronic disease has consistently been the top condition in Madera County. 39.1% of the total population in Madera County is considered obese. Death rate for diabetes in Madera County is 24 per 100,000 compared to California, which is 22.3 per 100,000. While not specifically mentioned among the community members, cancer and asthma are chronic diseases that are shown in secondary data as impacting Madera County residents.
When it comes to mental health and stress were common challenges brought up in all focus groups. Madera County reports an average number of 4.7 mental unhealthy days compared to 3.9 in California within the past 30 days.
Live Well Madera County is a group of representatives from about 30 community and governmental agencies in Madera County. They complete a CHA every 3 to 5 years. The 2023 CHA is the second one completed and is the first step in the process to improve the health of the community. The CHA data will be shared throughout events in Madera County to hear the thoughts and concerns of community members. Live Well Madera County and community members will then use the CHA data along with feedback from residents to help decide what problems are most important in Madera County and to develop a community health improvement plan, CHIP. To read the full community health assessment, visit maderacounty.com/CHA. Thank you.